Doctors and surgeons of Reddit. What was your "this just got even worse" moment with your patient S? I have many stories. One is a healthy 23-year-old male comes into with some chest pain. Normal vital signs. Never smoker. Normal chest x-ray. Pain started after eating something spicy. Tell him it's probably GERD. 5 minutes later he drops dead in his bed. Start CPR and get a pulse back. Stabilized. Get CT scan and has an aortic dissection. Dies again in CT scan and never makes it to the OR. The guy's major blood vessel basically just exploded. This happens to men in their 70s with a long smoking history and high blood pressure. This healthy 23-year-old had absolutely zero risk factors for this. No evidence of Marfan's or Ehlers-Danlos for the med people reading this. Still makes no sense to me. So many. The 80-year-old who came in with a self-inflicted shotgun wound to the chest as we are fighting to get him stabilized, and the surgeons are working to plug all the holes. None of us can figure out why the guy keeps oozing blood. Then we find out that he had intentionally overdosed on blood thinners before shooting himself. We kept him alive long enough to let the family come into the OR and say goodbye. The 45-year-old who came in via private car. Family drove him in, rather than an ambulance, after what was described as a head injury. We realized how bad it was when someone noticed a plastic grocery bag lying on the patient's belly. It contained the brains that the family managed to scoop up, in the hopes that we could re-implant them. The 30-something meth addict who also had a permanent catheter infusing life-saving medication directly into his chest for pulmonary hypertension. He came into the ICU with pH crisis. And then we found out why. He had been injecting meth into the catheter, creating a hole through which his life-saving medication leaked out. Medicine is a lot of things. Sometimes it's just tragic. I work in a cancer center, and fairly regularly a patient with multiple cancers will get a biopsy of a lesion trying to figure out which cancer has metastasized, and it instead turns out to be a totally different and unexpected cancer.
Not a surgeon, but my dad is. One patient who attempted suicide was put on suicide watch for a while. Said he was fine, slowly got taken off suicide watch. He asked for permission to go alone to the cafeteria and eat. Got that permission. Took a knife from behind the counter and slit his own throat. You have no idea how much blood there is in the human body until someone cuts deep. My dad described the scene like something from a horror film.
I once visited a friend in an inpatient psych facility. One of the guys there had slit his throat and both forearms elbow to wrist and was covered in staples. I have no idea how this guy lived long enough to make all 3 cuts and survive.
My teacher works in a health center. She deals with teeth, hygienist, and they found out that the newbie and a senior worker, someone who had been there the longest, didn't turn the autoclave on, meaning they had been using unsterilized equipment on quite a few patients until my teacher noticed. They then had to call every single patient they had that day or that batch was used on, and had to get the office to pay for every single one of them to get tested for STDs and other blood-borne diseases. Everything was negative, but I feel like this can fit here.
I can only imagine the fear of realizing, and the fear of being called to be told.
Obligatory, not a doctor, but I was a forensic technician assisting forensic pathologists at autopsy. One day, the chief and I were doing 3 routine narcotic OD autopsies. Oftentimes with ODs, our doctors would let us, the techs, do the whole evisceration to save time, so all the doc had to do was to examine the individual organs. So on the third decedent, she gave me the green light to start cutting. Once I had the chest plate removed, something didn't look quite right with his lungs. I called over the doc and she takes one look and goes, "I really hope you have your mask on as tight as it can possibly be." Her next words were terrifying. "That's tuberculosis." We immediately had to inform the Public Health Commission, kick everyone else out of the autopsy room, and convert our deco room, where we primarily did the exams of decomposed people, and turn on the extra duty ventilation system and had to complete the exam with the full PAPR kit on. That was fun.
I once had a patient in the ER who complained about a foot wound who wasn't healing and something in the wound was wrong. As I started to smell it, I thought, well, here comes another diabetic foot. But then I removed the bandages and started to see fly larvae crawling around. Had to swallow hard.
I work at an emergency vet clinic, and we get wound that are crawling with maggots a lot. The worst one I've seen was a dying eyeball crawling with maggots. It's enough to make your skin crawl.
A young newly married couple moves to town. He gets a good job, but gets admitted to my ICU with terrible pneumonia. Didn't take too long to figure that he AIDS-associated pneumonia, what we now call HIV. We didn't then know how to treat it, so we had to tell the soon-to-be widow that she was soon to be a widow. Then we told her about how HIV is transmitted, and she needed to be checked. Not a good day.
Man, that really makes me realize how far ARVs have come.
Not a doctor, but I work in healthcare currently. And if all goes well, hopefully I will someday be one. Had a patient come in for a routine mental health check-in. She started discussing her incredibly traumatic and recent miscarriage and then moved on to her extensive and increasingly horrific history of sexual assault. Every story was just increasingly more brutal. Needed a quick breather after that one. Not a doctor, but my mother had a friend. One of her only good friends of that matter, who developed breast cancer. At the time they only found it in one breast but warned her it could develop in the other. Her sister-in-law convinced her to keep it as a way to keep her womanhood. She gets the surgery but she's not getting better. A year later she goes in again. But the doctors inform her not only was it in her other breast, it had spread. She didn't have a lot longer. She died about 6 months later.
Ugh. My mother had the opposite experience. She would have preferred to lose both because she'd never trust the remaining one, but since it hadn't spread there yet, the doctors refused to remove it. Same end result, unfortunately.
My father went to hospital with chest pains. They decided to do an angiogram. Dye injected. He's lying under the machine and the surgeon suddenly changes his procedure. "Are you okay? Feeling well? Any blackouts?" "No," he replied. "Just pain." A few more docs come in and are looking at the screen. They take him to another type of X-ray machine and again are looking in bemusement without explaining anything. "You have a blood clot the size of a golf ball floating free in your heart. It's bouncing around the valves and we would expect you to have died very quickly from this." So they give him super strong clotbusters, but were concerned it might shrink enough to get jammed. A lot of experts turned up, but all went well and he had a triple bypass a few months later. That was 30 years ago. He's 87 now and can walk with ease up a steep hills.
Recently, I was treating a young infant in my PICU for a GI bleed. They had been there a couple days and seemed pretty stable. I felt comfortable to send to med/surg. Right when I told the nurse we can send them out, they pooped and vomited a large amount of frank blood. Right then I knew, and said in my head, well shit, this isn't good. You need to finish the story.
Patient came complaining of swelling in face. We suspected an abscess from a sick tooth. When they came, we called 911 immediately because the swelling had almost completely cut off her airway and her O2 level was an 87. A PSA to all. If you have a cavity or a broken tooth, it is a big deal. A rotten tooth can absolutely kill you. Any abscess anywhere on the body can lead to blood poisoning or system-wide infection. If it hurts and/or stinks, take it to a doctor. Got a story here from the Reddit archive. Fits the purpose. I knew exactly what story you linked before clicking on it. That one haunts me. Please tell me this isn't Dagoba. Eye doctor here. You may have heard that diabetics need to have their eyes checked regularly because diabetes is actually a blinding condition. This happened probably about 15 years ago. But this patient of mine I had noted had severe diabetic vascular changes against the retina and required laser intervention as soon as possible. Without getting into the socioeconomic arguments here, she scheduled her surgery and on the day of the surgery decided to take a work day instead of her surgery. Her job was cleaning, and on that fateful day, she inhaled some of her cleaner fumes which caused her to sneeze, spiking her blood pressure, and she blew the fragile blood vessels in both of her eyes wide open and blood started gushing into her eyes. As you might imagine, blood is opaque. You can't see through it. She was instantly and completely blinded in both eyes in a matter of seconds. It took 3 years, multiple surgeries, and a complete lifestyle change. But this patient did recover to have actually fair, but not good, vision. I still see her now for her annual visits.
Nurse here. Midwife let a mom go through over 8 hours of the pushing stage of birth to the point the mom went into severe decompensation, blood pressure plummets, saturation drops, fetal distress, etc. In Canada, midwives practice separately from doctors and nurses. They usually just have an agreement with hospitals to use the beds, although medical care is available if the delivery becomes high risk. Doctors take over and go in for emergency C-section. Realize the arteries in the sides of the uterus are ruptured due to pulling away from the strained uterus and extensive pushing. Baby came out fine, but they had to work on mom. Finally close her up only for mom's pressure to plummet again. They open her back up and realize another artery was bleeding, so they clamped her aorta until they could repair the damage. I.e., her lower body didn't receive blood flow for several minutes. They replaced her blood volume at least 3 times throughout. Finally the team stabilized her but were afraid of anything else unexpected, so they packed her but left the wound open, then sent her to ICU. I received baby in NICU. Baby was okay. Mom survived, although didn't find out much more.
Was coding a patient in room 1. I bring the family in before I call the code if they want, so they get a chance to say goodbye before I stop. Wife was clearly gone, had probably died hours before. Husband comes in, sees her laying there, grabs his chest and down he goes. His was a ventricular arrhythmia, VT, greater than VF, ultimately resuscitated. I saw him a year later for something unrelated and he thanked me for saving his life and told me he wished he hadn't lived BC life without his wife wasn't worth living. Man, that's sad. Loving someone so much that when they die life seems to stop and it's not worth living. My wife died in front of me 5 years ago. Wanting to live after that is the hardest thing I've ever done.